Okay, I think we're going to get going. Good morning, everyone. We're so pleased to welcome Governor Lamont, our students, faculty, and community guests here at the Hersey Center for Advanced Engineering and Health Professions at the University of Hartford. This facility opened in 2021 and was intentionally created to house our new specialized and technically rich facility to support our academic programs, the new academic programs within the field of healthcare administration as well as engineering. Programs that will continue to prepare our students for a future workforce within the state of Connecticut and beyond. So it's fitting that we're here today in this state-of-the-art simulation lab area along with the students that are behind me. That you'll be able to speak with. In this space, we will continue to meet the needs of high-caliber, dedicated, and deserving students for many years to come, while contributing to the health and well-being of our larger community throughout the state. We recognize how fortunate we are to have the support of the governor and the state in fulfilling this mission. And at this time, I'd like to turn over the podium to Commissioner Truthani.
So thank you very much, and it's an honor to be here at the University of Hartford today. We're very excited in the Lamont administration to present the announcement today about waiving certain barriers and fees to initial licensure for people in the nursing profession. What we know over the last couple of years in COVID is that many forward-facing jobs have taken a hit in workforce. We know that the pandemic also inspired people, young people, to join the ranks of the noble profession of nursing. But the Lamont administration has kept at the forefront supporting people who want to join this workforce and try to ease any barriers that may be present to doing that. And waiving licensure fees for initial licensure for licensed practical nurses, registered nurses, and advanced practice registered nurses is what we're announcing today. So with that, I would like to turn it over to the Office of Workforce Strategy Program Director, Tracy Ariel.
Good afternoon, everybody, and it is my honor to be here at the University of Hartford. The Office of Workforce Strategy is thrilled to be a part of the Lamont administration that has been supporting workforce development and these ARPA and workforce development programs, especially Career Connect and the Health Horizons grant that University of Hartford is participating in. It's a $35 million grant that pays for student tuition as well as for to increase faculty in order to increase the amount of nurses that are coming into the state of Connecticut. Here at University of Hartford, I hear that Health Horizons is paying currently tuition for 31 students, and they're all doing quite well. Congratulations. And again, we are really appreciative of the legislator and the government and the Governor Lamont's support. Thank you.
So what we know over the last several years, I just want to give you an example over the last 5 years. As I mentioned, in 2019, we had a workforce of nursing in the state of Connecticut, but what we've seen over the last 5 years is that we've had a 20% increase in the number of LPNs who have entered the workforce in terms of licensure by the department. We've had a 40% increase in RNs and a 50% increase in APRNs. To me, that says that we have people that want to enter and work in the nursing field here in Connecticut. And this is, again, another example of how we're going to be able to help this workforce get jobs and enter the workforce here in Connecticut. So with that, I want to introduce Chesarina Thompson, University of Hartford Dean of the College of Education, Nursing, and Health Professions.
Thank you. Good morning, everyone. This announcement is certainly wonderful news for our students, and I want to thank Governor Lamont for creating and supporting initiatives such as this that will remove barriers for our future healthcare professionals to enter practice. I have the privilege of leading a college that prepares future healthcare professionals as well as teachers. As you know, both industries have been and continue to experience severe workforce shortages in Connecticut and across the country. Addressing these critical workforce issues requires multiple strategies to help students complete their educational programs and eventually be employed in their professional choice. However, before they can enter the workforce, they must sit for and pass licensing or certification exams. The cost for these exams is in addition to the educational expenses these students have incurred for at least the last 4 years. Many of our students here at the University of Hartford are Connecticut residents and first-generation college students who come to us from very diverse backgrounds and a strong desire to make a difference in their communities here in Connecticut. Because of the additional fees, some students will delay taking these licensing exams until they have the funds needed to register for them. Unfortunately, delays in testing time post-graduation not only delays entry into the workforce, but is also associated with a lower first-time pass rate on the licensing exams. We want our new graduates to take these exams as early as possible when the knowledge they gained in their programs is still quite fresh in their minds. The governor's proposal to eliminate these application fees will certainly remove a significant barrier for these new graduates. Our nursing students at the university are fortunate to benefit from one of the governor's other initiatives, the Connecticut Health Horizons grant, that was specifically designed to provide scholarships to nursing students with financial need, expand capacity in our nursing programs, and support the development of innovative clinical partnerships to better prepare future nurses for the realities of the healthcare practice. Here at UHART, we are proud to be contributing to expanding and diversifying the nursing and healthcare workforce in Connecticut. In May of 2023, we graduated our very first BSN class, about 40% of whom were students of color, and many of those graduates are practicing here in Connecticut. Currently, we have about 250 undergraduate nursing students. About 1/3 of those students are benefiting from a Connecticut Health Horizons scholarship or participating in a focused clinical experience with our clinical partners that will better prepare them as future nurses. To address these critical workforce shortages in Connecticut, educators and prospective employers must work together to create an environment that attracts, retains, and supports new professionals entering the workforce. Initiatives such as the Connecticut Health Horizons grant and the governor's latest proposal to eliminate licensing fees are certainly steps in the right direction, and on behalf of all our future professionals, thank you, Governor, for your support. I would like to ask one of our senior nursing students, Geraldine Wiggins, who is the recipient of one of these great scholarships, to say a few words. Geraldine.
Thank you. Hello, my name is Geraldine Wiggins, and I grew up in Middletown, Connecticut, and I'm currently a senior at the University of Hartford in the nursing program. And this past semester, I was honored to be a recipient of the Connecticut Horizons Scholarship. The cost of higher education creates a burden on not only students, but also their parents each year. With the assistance of scholarships, that burden begins to disappear. Being a full-time student who works 2 jobs, I worry far too much about how I will be able to pay back my loans in the future. With the financial stress constantly in the back of my mind, I find myself focusing more on how to afford school rather than school itself. With the assistance of numerous scholarships over these past 4 years, my worry lessens each year. I have been able to apply myself to classes, study without financial stress, and find time to worry both of my jobs along with socializing with classmates. Although scholarships extend for beyond financial assistance, they are powerful enough to help students invest in a future where talent flourishes. My hope is that we continue to recognize the impact scholarships have on students as they build a brighter and more equitable future for everyone.
Work we do and the investments we're making into the generation that's going to help take care of all of us as we get older. With that, I'd like to now introduce Governor Ned Lamont.
Thanks, Benicia. Hey, good morning, everybody. Stephen, it's really great to be back at University of Hartford here just a few months ago with Jody Rell. I remember like yesterday, and here we are at the simulation room. It's amazing what you get to work with here. Looks like she just listened to a Ned Lamont stump speech. She's all that energized. A little spooky, keeps blinking too. But seriously, I want to thank each and every one of you for wanting to be nurses and being nurses here in the state of Connecticut. We've got this program because we need nurses. We realized what the essential and essential worker meant during COVID, and we realize it more today. And we were coming out of COVID, we're desperately short of nurses. We're scrambling. Just at the very same time, the nurses who had, gone to hell and back during COVID, then we're asking them to do double duty. And thanks to this program, thanks to the Health Horizons program, thanks to the scholarships, thanks to 593 scholarships. Glad, Darylyn, you were one of those folks able to take advantage of that. Let you really focus on your studies without the distractions. We've also been able to really do outreach for more instructors in nursing. That's been a shortfall for us. I think the program has got about 38 more nursing instructors, more diverse corps than we've ever had before. And specifically what we're announcing today is just the elimination of some of the application fees. It's not a lot, but it's a little, and I'd like to think it makes a difference. It's everywhere from $40 to $200. It's just one more little speed bump that may make you hesitate before you get into nursing. And to make this seamless, to make this easier, to help you get going, is what we're trying to do in nursing, and we're trying to do it in home daycare workers, eliminate that fee as well as for teachers, and making that easier for folks to be able to get their degree faster without the application fee, help support some of the testing costs you've got. So we end up with more daycare providers, more teachers, and particularly more nurses. We've got some of the best health care in the world, and a lot of that is thanks to each and every one of you. You'll be dedicating your lives to saving other people's lives, and I want to thank you for it, and that's why we're here today. Thanks, Stephen.
Okay, we can take on-topic questions now.
Can you talk about the shortage that Connecticut was facing? I know a lot of states were, and how initiatives like this and other things have helped kind of encourage more people to complete the program and become healthcare professionals.
I think what we saw through COVID is that we already had a stressed healthcare system with then a worldwide pandemic on top of it. And for so many forward-facing workers who had to show up in person every day and do a job of taking care of sick people, particularly in the profession of nursing, it is a lot of taxing work for the person who's at the bedside of a sick individual. And what this investment from the Lamont administration shows over the last several years, what we're announcing today, as the governor mentioned, is one small measure, but it's a piece in a broader narrative of how we are trying to uplift the nursing profession, invest in the success of young people who are trying to get ahead in life and make a difference. These are mission-driven people. These are civically oriented people who are interested in making a difference in the lives of others, getting scholarships, getting other training opportunities. What we're announcing today is just one more piece of that, to being able to help us move forward in bringing forward the nursing profession in Connecticut.
That's a $35 million grant.
That is separate. That the Office of Workforce Strategy has been working on, is this $35 million grant. That's correct. What we're talking about specifically today is roughly $2.5 million in initial licensing fees that the state receives for initial licensing in terms of nursing professions.
How much is the application fee for a student?
As the governor mentioned, it can range, but in the $130 to $200 range roughly, and some of the other professions may go lower, but in nursing, it's in that range.
The numbers that you gave at the start for the increase in the RNs and the APRNs, those were gigantic numbers. Are those to fill in people who are retiring, or have we really expanded? Do we have far more nurses than we've ever had in ever?
I can't say about ever, but we definitely have far more than we did in 2019, which was pre-pandemic. So I think what I was trying to highlight with that is that the pandemic put a strain on our nursing workforce. What I've seen in healthcare, though, is there also is a generation of people that were inspired by the pandemic. I don't know if that's true for any of you. If any of you were maybe interested in joining nursing because of what you saw, because of maybe what you heard from family members, what you saw from others, from other anecdotes that I can say from healthcare professionals. There are a lot of people that went into this in part because of the pandemic. So there are people who have left because of the pandemic. And so we do need to backfill in a sense and really grow the workforce that we need in nursing. That's part of what we're seeing happening. And I would like to think that some of the incentives that have been put into easing the burden of what it means to go into these professions are alleviated a bit by reducing the financial burden that can come for any of this type of schooling.
Okay, so those were increases in the total number of nurses. You're not talking about backfilling because 5,000 people retired. Obviously, you're probably hiring 7 days a week, frankly, across
Right.
the state.
The other thing that is hard to capture with our numbers in the Department of Public Health is we have more people licensed as nurses. That does not mean everybody is working as a nurse. Just because you hold a license and pay that annual renewal fee may not mean that you are still working as a nurse in the state. That is hard for us to capture as a department because we really have that firsthand knowledge of who's being licensed. So I think some of that may not be captured in our numbers. And that's why we still feel workforce shortages throughout the state, because we could have people who've retired from a nursing job but are still licensed as a nurse.
So to be clear, you still believe there is a shortage of
Yes.
nurses in Connecticut despite the increase in licensed nurses?
That's
Is
correct.
there an increase in the number of nurses working?
Is there an increase?
You mentioned the figures you gave, 40,
Right.
30, 40, and 50%. Those are numbers of licensed.
Licensed, correct.
Is there an
It's
increase
harder
in-
for me to have a full view in terms of the full cohort of nursing jobs in the state. What I can say is that from our employers and various people who are trying to hire nurses, there is still a shortage. So I believe there is still a shortage when what we can, and I think our Office of Workforce Strategy may have even some eyes in that because of their initiatives in improving that workforce. But we know that there are more licensed people, but we also know there's still a shortage.
And how many nurses does the state employ? Do you know? Not just in all the departments.
In all the state departments,
Yeah.
I don't have that number
But it's
off the
thousands.
top. Yeah, I mean, definitely thousands. We run hospitals, we run other places through the state, so it would definitely be in the thousands, I would think, but I don't.
The annual renewal fee of $120 for RNs, that would cost more. Is there a thought to eliminating that fee too, or is that just too big a ticket item?
I think this is the first step that we're doing. I don't know if you have other thoughts.
We're just getting started.
We're getting started. There you go.
Governor, a year ago, CBIA had made sort of proposals to reform occupational licensing in general. Their claim a year ago was that Connecticut requires a higher degree of occupational licensing than other states. Is this anything the administration has looked at?
Yeah, we have a lot of licenses, a lot of licensing fees, including in the occupational area. It's something we have looked at. We continue to negotiate around it. Obviously, it's a revenue item as well because we use that to keep some of our offices going. But it's the type of thing we're going to look at. We're trying to do what I can to get some of the regulatory underbrush out from under. I find a lot of these fees are quite regressive. They discourage people from going into professions, and I'm trying to be able to speed that up and make it easier for people.
Are you gonna be expanding this, Governor, to other professions? In other words, is today day one of a series? We're gonna see real estate agents tomorrow and other people?
No, not tomorrow. Let's see what the budget looks like a year from now. Right now, I got a guy named Jeff over there who's keeping a close eye on me to make sure we stick within our budget. But this allows us to do that.
Right, but I mean, in other words, you know better than anyone else, a lot of people are licensed, and engineers, all kinds of people. I guess, so the question is, are we gonna have other people, or is this a one-shot?
I think we're going to have others, not in this budget cycle, but it's something we look at, something Brian looks at, and Mark looks at. It's relatively costly, somewhat regressive, regulatory burdensome, and discourages some people. I want to make it easier for people to be, in this case, nurses.
Are you going to be rolling out other initiatives between now and you delivering your budget revisions a week from today?
A little bit, yeah, but not a lot of revenue items.
So why is Mr. Beckham here? I figured,
know,
I
ask
figured
him.
we were
Come
going to
on
get a
up,
briefing.
I'd just like to hear the governor speak. So are you suggesting there's not a shortage of real estate agents?
Shortage of houses for real estate agents to sell. That's what we're working on.
Were you gonna double the fee for lawyers? Is that what you're
That's an idea. Thanks, everybody.
Thank you, everybody.
Hey, you guys, thanks for being here. Really nice to see you.